Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, where we explore the intricacies of tocilizumab and its role in medicine. I'm your host, Dr. Shikha Agrawal, and Prachi Virat is here, our microbiologist sleuth with a passion for microbiome and bioinformatics. Welcome to the show, Prachi. Let's unravel today's episode the science behind tocilizumab, unraveling its pharmacokinetics and pharmacodynamics.
So glad to be here, Dr. Shikha. Thanks for setting the stage so nicely.
To begin with, how does tocilizumab get into the system and start working?
Good question. So, tocilizumab is typically administered either intravenously or subcutaneously, depending on the clinical situation. In severe COVID-19 case, it's often given as intravenous fusion because that ensure rapid availability in the bloodstream, which is critical during acute hyperinflammatory state. Once infused, it begins circulating and seeking out its target, the interleukin 6 or IL-6 receptor found on the surface of immune cell and soluble receptors in the blood.
That's interesting. And once it's in the bloodstream, how is it distributed throughout the body?
Once in circulation, tocilizumab is distributed primarily within the vascular and extrafluid spaces. It has a distribution volume of about 6 to 9 liters, meaning it mostly stays in the blood and intestinal tissues rather than excessively entering cells or crossing the blood-brain barrier. Its distribution is heavily influenced by presence of IL-6 receptor. It tend to localize where there is significant immune activity.
Can you walk us through how tocilizumab is metabolized and broken down?
Sure, tocilizumab is a monoclonal antibody, so it's not broken down by the liver like a small molecule drugs. Instead, it's degraded by reticuloendothelial system, primarily through cellular processes in the liver and spleen. Specialized immune cells internalize the antibody and it's catabolized into amino acid and small peptide through lysosomal degradation. The rate of breakdown can vary on how much IL-6 is present. Higher IL-6 level means more receptor binding, which can alter its clearance.
And how is tocilizumab eliminated from the body?
Since it's a large protein molecule, tocilizumab is not excreted unchanged in urine or feces like many drugs. It's eliminated by being metabolized into its constituent amino acids, which are then recycled or excreted through normal protein catabolism pathways. Its half life ranges from 8 to 14 days, depending on the dose, whether the patient is high IL-6 activity, which can affect how long drug stays active in the system.
Let's switch gears to pharmacodynamics. How does tocilizumab's binding to interleukin 6 receptors impact the body's inflammatory response?
Great transition. So, when tocilizumab bind to the IL-6 receptor, both the membrane bond and soluble forms, it prevents IL-6 from docking and activating the downstream JAK-SAT signaling pathway. This blockade interrupts the release of acute-phase reactants like C-reactive proteins, CRP, and halt the amplification of pro-inflammatory cytokines. In a sense, it helps calm the overactive immune response, which is exactly what we want to control during a cytokine storm in severe COVID 19.
That was a clear explanation of how tocilizumab works in the body. What's the key message you hope our listeners walk away with?
Thanks, and I would say the key takeaway is this. Tocilizumab is a precision tool that targets a specific pathway in our immune response, making it valuable option in conditions like severe COVID-19 where IL-6 is a major driver of inflammation. While it's not cure all, when used at the right time in right patient, it can be a meaningful difference. It can bring a meaningful difference in outcomes.
It is conversations like these that make this podcast what it is. Thank you for being part of it, Prachi.
Appreciate being here. Thank you so much, Dr. Shikha.
That's a wrap for today. Huge thanks to our listeners. Don't forget to follow us on our favorite podcast platform and share this episode if you found it valuable. Until next time, stay curious.